Thank you, Chair. The two panellists have done a really good job of exhausting nearly all discussion topics in this area, I think. But just so I can summarise where we're up to, you've told us that you think occupational roles are important, multi-generational households, high-density housing, deprivation, biological or genetic factors, poorly quantifiable cultural issues. But we still have charts that show that some ethnic minorities are at much greater risk of harm from COVID. And so where do you think that the gap lies? Is it confounding factors, so things that haven't been considered? Is it those issues I've just listed but just weighted incorrectly? Is there any other investigation that we need to do as a country that you think should be prioritised?
So I'll have a first go at this. I think there are likely to be unobserved and confounding factors which are yet to go in there. I mentioned earlier in some of the discussions, some of those points around actually the transmission within household, between the index case into the household and wider. I think the other aspect which Professor Fenton touched briefly on here is self-isolation. I think that's really important. We know from King's College that 70% of people fully intended to self-isolate for a fortnight, but only 18% actually did once they had COVID. And therefore, the figures around self-isolation, I don't have those by ethnic minority, but that to me feels a very important concept given what we know about likelihood to live in deprived areas. And then the final bit is behavioural, where we've recently expanded our opinion survey, which will give us more insight for different ethnic minority groups about behaviours. And I think that gap around the behavioural work, because we know the behaviours often drive this pandemic, feels important in terms of if you're asking me where the gap is.
Thank you. And finally, do you think you're going to get to the bottom of this so we can fully explain the situation?
So I think it's going to be an evolving journey. And then as we have more research, as we have more experience in responding to the pandemic, we will continue to improve the ways in which we're responding. And a good example of this, today's World AIDS Day. And I began my own career working on that pandemic. And similarly, as new treatments have become available, new better surveillance, better data, better research, we've been able to target, engage communities, and really help to drive rates down. So at the point for HIV, we're now thinking of ending HIV within the next decade. So similarly, as things are evolving with COVID, I would fully anticipate that we will see both a reduction in inequalities, better engagement, and a really real honesty about some of those social and structural factors which are driving the pandemic today and tomorrow.
That's very positive. Thank you.
Thank you.